A woman's health is of utmost importance for the men and women who run Griffin Hospital in Derby. The hospital's new Center for Breast Wellness is evidence of that. It kicks off its grand opening this week, bringing together state-of-the-art technology as well as experienced doctors and staff. Joining us for a look into this facility is Dr. Zandra Chang, Medical Director for Breast Wellness at Griffin Hospital, and Marge Deegan, Vice President of Ambulatory Services at the hospital. Welcome to the both of you.
Thank you.
I know this is very exciting. Let's talk about this center. This is a very unique one. So explain to everybody else why it's so unique.
I think first off, one of the things is most patients are used to, or people are used to going in and trying to be scheduled in at kind of like the doctor's convenience and things like that. We really believe the patient needs to come first. So we want to do things, believe it or not, at the patient's convenience. So one of the first things when a patient comes in, they actually get asked, you know, you're going to have a mammogram today. Would you like to stay for the results? If not, you know, how can we contact you? If there is a finding, would you like to be worked up today? We don't want to just assume things. We know people are busy. Sometimes, you know, you just want to come in and out. Other times, if you want something, you want it worked up. And we basically want to serve the patients according to how it's convenient for them.
So the focus is the patient.
Yes.
And I understand not just women, Marge.
No, men too can be affected by the disease, so we certainly service both men and women.
All right. And what's so important about this center, not just because it's a patient-centered facility, but what else is there about this center, Marge?
Well, it's been a long time in the making. I think probably our efforts began about 10 years ago when we first realized that some of the state tumor registry data indicated that the Valley had a higher incidence of breast cancer and that the mortality for women in the Valley was higher. So, you know, we began to look at that very seriously and realized we probably needed to do a better job with community outreach, but also kind of explored, you know, why was it that women tended not to get mammograms? And certainly one of the most, you know, compelling reasons was sort of the anxiety that they would experience, you know, just at the very thought of, you know, hearing the outcome, which, you know, could be bad news. So we've worked very hard at developing a patient-centered approach, and as Dr. Chang suggests, you know, really putting the patient, you know, at the forefront of what we have to offer with very timely result reporting, and also assembling all the services that they might need within the center. So it's sort of one-stop shopping. We certainly have benefited from the expertise of physicians like Dr. Chang and others who we can call into action should we need to help advance the women through their diagnoses.
Now, the facility is next to the hospital. Let's take a look at some of the pictures that we do have here of the facility, and here it is. And what are we looking at here, Dr. Chang?
This is actually our new stereotactic table. So sometimes the biopsy, because of the success of mammograms, so we catch things before anyone can feel them, the only way to do a biopsy, and not by surgery, we want to be minimally invasive, is by using a needle biopsy. So this is a brand new table that we have. It's actually the latest, the greatest, you know, that Hologic had.
Exactly.
We're very happy with it. It's got Tempur-Pedic pads on it. You know, we've got a whole crew in there when the patient's there, you know, to make this the least traumatic as possible.
Absolutely. Let's take a look at the next picture. This is a patient exam room?
This is actually our ultrasound room. So there, you know, the other thing that we want to make sure is that patients don't come in and feel like it's a sterile environment. So the colors are kind of warm and neutral and the table's actually relatively soft, you know. They'll be there. They can take a look at the ultrasound while the exam is being done. And so it's very private.
And of course, this is where women get a mammogram.
Yes, and this is one of the units by Hologic. Hologic is actually also on the brink of bringing new technology in terms of the technique called tomosynthesis, which is now almost a 3D type of look at the breast. It's like a 3D mammogram. And it's really thought that hopefully in the future it's going to really help increase detection.
We have to go, but just really quickly, I know this is also for men, and many people don't know that men actually also have breast issues.
Absolutely. So men can get any issue that women can get. They can get a breast lump, they can get breast pain, they can even get breast cancer. The rate of breast cancer in men is a lot less than in women, but, you know, a few people like Peter Criss, Richard, Roundtree, they've had breast cancer as well. So it's something that is meant really for the entire community, not just women.
Very good. Now, if you want more information on the Center for Breast Wellness at Griffin Hospital, it is located in Derby. All the information is on the screen, or come to WTNH.com and click on Connecticut. Thank you both for being here.
Thanks for having us.